We did this preparing, so we're probably there, I would have thought.
I think we are. I think we're here. Hello. Hi, everyone. Thanks for watching. Thanks for watching on the replay. If you're watching on the replay, we're here to answer your questions about vet care and ailments and food and nutrition. So there's just the three of us at the moment, Dr. Lise Hansen, Dr. Tina Hansen, who goes by purplevet.com, I'll have you know. Oh, no, it's not, is it? It's purple.
It's actually purple. Yeah, purple dot
I
vet.
get that every time, sorry.
Pretty happy with that.
And, I'm Caroline from the Association of Pet Nutrition Consultants, APNC.UK. So we're here to answer your questions. As I said, if you're watching on the replay and you would like some questions answered about your pet, then you can still ask them and we will refer to them next week as well. So that's totally fine. We're here at 6 p.m. UK time every Tuesday as well. So you can pop back Thursday. Goodness, it is Thursday. I don't know why.
2025 Thursday.
It's been Thursday since we started. So yeah, sorry about that. Anyway, yes, so we're here. Yeah, it was too good to be true, that wasn't it? So yeah, anyway, another thing that's too good to be true is that we have an amazing guest called Christina from the USA, and we tried to have a guest with us from the USA once before, and timescales didn't quite match. So she may arrive at 18:45 thinking that she's on time, because I think that the sort of hour changes that we have over here seem to sort of throw people across the pond. So we shall see what happens. Yeah, she may be here. So Christina is another holistic vet.
Lily Chen. Yeah.
No, I was going to say it's Lily,
it's
isn't
not
it?
Christina,
Yeah,
it's Lily. Well, and she is.
Perfect.
Amazing.
That's awesome.
Fantastic. Can you hear us?
Yeah. Can you hear me?
Can you hear me?
Yes.
Yeah.
It's a little bit woolly, but we can hear you. We're actually live already, but welcome. No, she's been either muted or muted herself.
Yeah, I think you muted yourself there.
There we go.
Yeah, but why don't you introduce yourself?
Give me a sec. Can you guys still hear me?
Yeah.
Okay. Well, I'm Dr. Lily Chen, and I am a practice owner for an integrated practice in Los Angeles, California. I started this practice 5 years ago in 2020, and been a veterinarian for about 18 years now. So I would say I started really conventional, and probably 3 to 5 years in, really realized that there's been a lot of chronic diseases, issues that Western medicine doesn't quite have the right answers and options for. And then started learning acupuncture, then herbs, and it just opens this whole new world for me. And now our practice is primarily holistic, but we will bring conventional therapy in when it's appropriate. And we are specializing in integrative oncology right now.
Oh.
And
love to hear more about that.
That's very interesting. I also heard, I think you wrote in one of your emails that you're doing a course on poop transplants.
Yeah, so there are a couple of therapies. I mean, besides acupuncture, for me, was what initially opened my eyes to what's possible. In the last 5-10 years, I've also have felt that there were cases that just acupuncture alone, sometimes they're already in a very advanced state of disease, that acupuncture and herbals alone, honestly, it just takes too long to have the effect, and many diseases are rooted really in immune system dysfunction. So microbiome therapy has been like a cornerstone and like a life-changing modality that I've utilized in my practice and have learned, because there's really no training out there right now for animals that really put everything together. So it's a lot of figuring out, it's a lot of digging into research, even on the human side, and a lot of kind of doing with our patients here to see what works, tracking their microbiome tests and tracking their clinical symptoms. As you're doing that, so you're doing microbiome therapy, I found that there are a lot of diseases that we initially thought they were incurable, right? Like allergies or inflammatory bowel disease, pets with chronic diarrhea, autoimmune issues, and now my cancer patients. I have seen complete turnaround just by really normalizing and balancing out their microbiome. And it, to me, is a do no harm protocol as well. Like there's nothing to lose. They don't get sick from this, and why not try? So I think it's just that I have seen so many patients that have life-changing results from this therapy that it is time to put something out there. I can really put the power in more vets' hands to be able to offer this to more patients.
That's amazing. And to the veterinarians that are listening, or pet professionals, how do you do it in practice? Do you use like a freeze-dried oral product? Do you give enemas? How do you choose your donors? When do you like parasite test the donors and stuff like that? I think it's something that stops a lot of practitioners from going through with this.
Yeah, so there are actually a lot of different ways to do it. You can get fresh fecal samples. So we can talk about how the method of actually doing it. But I have tried in the beginning. There are companies that sell oral fecal transplant capsules. So Animal Biome being one big company that came out with it. Legacy Biome is another company. And Dr. Margot Roman have her own line and her own donor dogs. So it feels like that's an easier way and a less invasive way of doing microbiome therapy, fecal transplants. So I did do that for a few of our patients in the beginning, and I tracked my microbiome pretty closely. We tested probably every 3 months for most of my patients. And if you're on oral microbiome therapy, oral FNT pills by themselves, I have found that it would take minimum 6 months, maybe a year to even see a difference. And it does not really balance out the microbiome if you started out with a very severely imbalanced microbiome. So one, it takes too long for many patients that are coming in with diseases already. They don't have 6 months to a year to wait for this to happen. And also I find that it's also very expensive. These fecal transplant capsules, like per bottle, it's probably $200 to $300. So the amount of money that they're spending on this for a year, you would actually save, clients would actually save money by doing, what I do is rectal infusion of fecal transplants. And it is like an enema, except you don't want it to come out. Like you are not trying to induce things to come out. So the technique is fairly simple. If you've ever work with a red rubber catheter, that's all it is. You're inserting it rectally. I think what I figured out, the part of the protocol that took the time to figure out is like, okay, how much, how often, which patients, right? So that part is probably a little bit too much to go into. But in terms of donor selection, there are a couple of different ways to go about it. There are companies that make dry powder. So Animal Biome, again, is one of the first company to do that. And they have their own donor populations. Most of them are dogs that live with people like their real pets, and they are screened for diseases, parasites. They're considered healthy. And because they are from Animal Biome, they can do their own microbiome testing and make sure that their microbiome is healthy for the transplants. Dr. Margot Roman is another really good resource to look up, because what she has raised generations of poodles that she's been doing this work for 30 years. So she's one of the first doctors to really pioneer the microbiome therapy. So her poodles are minimally vaccinated. They have not taken medications and live on really good soil, mostly vegan fed with some raw food diet. And the microbiome of these dogs are superb because they're passed down through generations, right? So if you've got like 6 or 7 generations of dogs doing this, you're going to have really superb donors. So we do use her donor material. They come to us as frozen nuggets. What's the best way to frozen poop in jars?
Actually, frozen shit. No, we're not calling it that. What should we call it?
Sometimes you'll see like little leaves and like it's the real deal. I have colleagues, and I'm starting to explore this. I just haven't done a whole lot of this because I haven't on the ground found a great donor. But I do believe that fresh donors, if you find really superb donors, are actually much better than fecal transplant material that comes in powders or frozen, because you still lose some viable organism. There is actually a published guideline from Texas A&M University about donor selection, but the gist of it is that for most of us that are veterinarians, you know what healthy dogs look like and you know what to screen for. Of course, run their baseline, make sure on their blood work they're healthy and they don't have any diseases that you're worried about, like allergy, immune issues, like parasites. Screen for healthy donors and screen for parasites. And yeah, and you can take poop from fresh donors and just transplant it directly. Do mix it up with some saline to make it into a slurry so you can do the actual transplant process. Conceptually, it's not hard. It honestly is being able to figure out that right consistency of poop to saline so that it can go into the animal easily. You, of course, ideally want them to have already defecated that day and they're emptied out. And ideally, you want the material to stay inside the colon area for as long as possible. We say minimum of 20 minutes, which is not that long, right? But ideally, the rest of the day, we sometimes will have them come in the afternoon and just say, okay, try not to let them poop till the next morning. When I do these procedures, there's also, the way I figured it out, there's also a science to the volume of it, because when we first did it, if it's too much, that sensation will make them want to poop it out right away. So that's the part I think is a bit of the nuance that I'm teaching inside the course, or who are good candidates, how much, how do you mix it up, how to select like the best material for you, and then rechecking, communicating with the pet parents. I think a big part of this, as veterinarian, I don't think that teaching veterinarians how to do this procedure is very hard. Honestly, it's so non-invasive and so easy. The harder part I find is the mindset of one trying it, right? Because it can be a foreign concept to a lot of people. There may be just a block of not feeling confident and not understanding how it's going to help, and being able to at least be open-minded to try. And then the communication part of helping the pet parents understand what this is trying to achieve, because that is also sometimes can be a very weird concept to a lot of people. So I think a lot of that is what I really would like to teach others so that they can successfully implement that. Let me see, did I answer all the questions?
Do you have any preferences or requirements about the diet of the donor dogs?
So right now, because I'm not using my own donors yet, I would say that for me, ideally they are fresh food variety, and that, but the end result is they all have to have at least their microbiome tested and make sure that they have a very healthy microbiome. As far as like a hard rule of like what kind of diet the donor dogs have to eat, no, because I truly believe that diet has to be a very individualized choice. I know that nutrition is such a big and hot topic in the animal care world, and I love listening to everyone's like opinions. On the ground, as a person, I will always advocate for staying away from processed food. But I also don't believe in shaming people for, if for economical reasons they have to do that, then it's giving them power back of like, okay, what toppers can you add? What other things can you do? That's really easy to really increase the spectrum of diet variety. I think the biggest thing that I will stand behind is that we really have to move away from the concept that once you have a food for your pet, like do that for life. For when I graduated as a baby vet, that was the thing. It's like, oh, you find a diet that works well with this pet and they can eat it for life as long as it's complete and balanced. And now we know like that. The one that's not healthy for the microbiome too, that's just not even the right sort of emotional enrichment for that pet. And there's so many layers to that. But I do think our modern pet microbiome is so messed up because we've had this practice for now at least like 50 years that some pets are eating the same food all their lives. And it's setting up for a lot of chronic inflammation through generations. So that I always stand behind is like, even if you're feeding a kibble diet, rotate it and find the best, kibble you can. But my thing is that whatever the people come in with, let me work with you and let me see what you can do for your pets that is going to work out the best for you.
I think that's such a good point, and it's so easy to get into this people barricade themselves, but and because you have different opinions, then you're just seeing things as black or white. I think it's a really good point that there's always something you can do to improve, even if you're not going to be taking out a cleaver and doing your own butchering and feeding whole carcasses or whatever.
Right.
You can add something to whatever you're feeding, even if you're feeding something processed as a base. I think that's a really, really good point. Can I ask you another question? Because I see sometimes when I take in a new patient, I always ask them what they're on, and I've seen a couple that were on fecal capsules. And sometimes they have either been prescribed by someone else or maybe found it themselves, and then they take it for a month or even just, I'm not sure how much is in one, but it's like 1 month or something. They take a very limited, like a short course. If I'm hearing you correctly, you're saying that's neither here nor there in terms of making an effort to take a short course. Or
it depends, right? Because if that pet doesn't have issues, you may just be adding to the diversity of the microbiome. And that's really helpful. When I do probiotics, I also like to choose probiotics based on their microbiome profile, because we have seen microbiome of pets that have been, pet parents will come to me and say, oh, my pet's been taking probiotics, it must have good microbiome. The thing is, let's just say, for example, lactobacillus is a common one in probiotics products. And we have seen profiles where it's like, there's so much lactobacillus in their microbiome, it is actually causing problems because it's so imbalanced. So same thing with these fecal transplant capsules, that it's not probiotic in a way where it's just a couple of organisms and billions of it, right? It's more like there is a diverse group, and it's very equivalent to, I think, if pets are allowed to be in environment where the soil is healthy, or they are, more prebiotic and soil-based probiotics, that they are out in nature and they're getting that themselves, right? It's like that. If they do it for a month and they're not treating very specifically for an imbalance, I think they can add to diversity. But if they have a really imbalanced microbiome, taking it for a month probably isn't going to maintain a healthy one. So what we've also seen in research is that if there are some pets, part of it, when we think about microbiome, is that microbiome is that community of organism, right? That actually lives in their own layer in the gut, right? And then you have your actual intestinal layers, that's the substrate. When the substrate actually has to be healthy for healthy microbiome to thrive. So the deeper layer to microbiome is that besides making sure that, okay, whether we're doing fecal transplant orally or rectally, there are some pets that cannot maintain a healthy population of microbiome. It is because their intestines have remodeled so much. We haven't fixed the inflammation. Sometimes it's gone so severe that just putting in healthy microbiome, those microbiomes are trying, but on a very unhealthy substrate, they cannot thrive. So that's another layer to it, I think, is we also really need to look at how healthy the intestine layers are and how healthy that substrate is. I always think of a garden analogy with microbiome. I think of microbiome as the flowers and the plants in the garden, right? But if you don't tend the soil, no matter what you plant, it will last for that season. Then it's gone. It's not going to come back the next season. So the deeper layer is nutrition and lifestyle, and sometimes supplements as needed, because fiber and prebiotics so important to maintaining that. So that's another thing. Innovative Pet Lab now has markers that will measure inflammatory markers specifically for those intestinal layers. I just don't know. The next piece I'm trying to figure out is that when I do find that they have a lot of inflammation in intestines, what can we do to reduce that inflammation? That is actually a harder question right now, because I feel that I have a pretty good handle on restoring microbiome. But sometimes if you get like a 12, 13-year-old pet that already has a lot of inflammation, right now, when I talk to some of the researchers and other colleagues that's been doing this a long time, it seems that by that stage, you do have to do microbiome, sometimes these fecal transplants on a maintenance basis, like once a month, because they die off. It's kind of like your garden. If the soil is not healthy and you don't have 10 years to do this soil, then you got to plant new flowers every month, every other month, to keep that garden thriving. So that's also something that's very interesting to have figured out too.
I think that's really key as well, because we put a lot of exception on these FMTs, especially here in the UK. We haven't had them that long really, to have an official FMT that people can use for their dogs. And some people have kind of been making their own as well, and their dogs have improved. I had a client, and she's a student of mine actually, and her dog had a really low diversity, and also on top of that had something which I'd never seen, and neither had the pet biome lady, and it was a pathogenic strain of rat bacteria within the microbiome. It was really strange. Anyway, the FMT did seem to make a difference in terms of the symptoms, and did seem to change things in terms of addressing this rat bacteria. But then gradually the symptoms returned. And I think what's happening, we are sort of saying, right, let's shift the microbiome. But we're not then thinking that alongside the FMT, we need to be healing the epithelial lining, are we? And I think that is really key, because actually, when I talk about probiotics, I would always talk about healing the epithelial lining, but you almost forget that FMT is essentially it's like a superfood probiotic almost, isn't it? You know, and that's all it really is. It isn't this other way of medicating them. It is just a really super duper probiotic. So we would still need to be following those protocols, perhaps feeding glutathione. I'd love to know more about the inflammatory markers that are specific to the inflammation of the gut. I think that's going to be a really interesting area of research in the future.
I think so. Yeah, I completely agree. I think while I love microbiome therapy, it feels still a bit symptomatic, right? Part of it is the whole conversation needs to shift into doing things for these pets when they're puppies, when they're young adults, right? Before they have issues, because by the time the intestines remodel and have inflammation and they are now 10, 11 years old, we can't turn back time. So not right now, the model I really feel for veterinary medicine, I would really love to see a shift into doing a whole lot more preventive when they're young and they don't have issues, because that's our way of preventing inflammation before it happens. So that's key. And then that's our only hope for keep breeding. And that's future so generations.
Yeah, and that's exactly what I couldn't agree more. I mean, and that's about not over vaccinating, not using antibiotics needlessly, careful with the non-steroidals, all that sort of stuff that wears away that natural resistance and introduces inflammation.
Dewormings.
Yeah. In the places that are still doing that, yes. Absolutely. And I have to say, when we talk about chronic inflammation and preparing the soil, that, I mean, I have to mention homeopathy as the best way I know to do that when you've got chronic inflammation. Absolutely. I love that. I agree with what you're saying.
I am not trained in homeopathy. That has been on my list for so long. So that's amazing to hear. I think that maybe definitely for people that are experts in homeopathy, feel like that we need to collaborate more, right? Because again, I feel like my time is really short for wanting to learn all the things that I want to learn. So it's really building this community where we can lean on each other, and
that's what we're trying to do right now. That's why it's so nice to to meet and to hear someone else say the things that you're hearing yourself say and thinking every day. But it's nice to talk to everybody else like you who are doing the same thing and experiencing the same thing in different modalities,
but
maybe.
Also, Lise, it's like extra stuff. I didn't know about using FMT for in oncology. I mean, it makes sense, doesn't it, to use it for cancer patients, but I've never really looked into that or heard of that happening over here. I mean, can you give us a few examples of animals that you've supported?
Oh my God, yes. Like, I'm gonna get really excited about this. I just posted Henry's story yesterday on my Instagram. So Henry is a 12-year-old golden retriever that came for lymphoma. And Henry has had a lifelong history of diarrhea. Mom herself is actually a veterinarian. So, she's done all the things. She's tested all the things. She's trying to figure out the diarrhea. She's taken steroids because it was diagnosed as IBD, blah, blah, blah. And he's eventually, of course, being put on a hydrolyzed protein kibble diet because that's the thing to do, right? But even on that, like, he still gets diarrhea. The hydrolyzed diet isn't actually fixing it. So by the time he came to me he had GI lymphoma, of course, there are a host of tools that I reach into for integrative cancer. I'm going to focus on microbiome for a second, especially because it's GI lymphoma, right? That's originated from the gut. And when I heard about his story of having this lifelong diarrhea, I'm like, that, of course, that is a trigger for the GI lymphoma. Let's see what we can do. So we really started with a microbiome, like the FMT rectal fecal transplant, like 4 sessions in. He was ready to be transitioned to fresh food. So after the first and the second session, Mom was like, oh my God, his stools never looked this good. I'm like, just wait. and then we started introducing fresh food, and Mom was so nervous because this is a dog that if you say, like, give him a blueberry, right, he'll have blowout diarrhea. The gut is that sensitive. After we've done 4, we were able to start introducing fresh, more like vegetables and plants. Plant-based diet at first and not proteins yet, but by the 6th one, we were able to transition into different proteins. We did some intolerance testing just to figure out which are the good ones to introduce first and not just guessing. So we did do some intolerance testing, and now he is ready to be fully transitioned. He's on a variety, he's on toppers. And I think the part that makes me super passionate about this work is that this is a dog that has lifelong issues and is dealing with cancer. And just by fixing the microbiome, he's eating better, his energy is better, he feels better, his lymphoma is better. Like, he had like chronic liver value elevations, that's better. Yeah, we're still following him with his lymphoma right now, but I think he's gonna beat the survival times by so much. And I see that again and again in my cancer patients, the ones going through chemo, that's really harsh on the gut, right? Why not do some fecal transplant microbiome just to support them if they're going through chemo? So a lot of cancer pets, if they're going through the conventional route, while you're killing the cancer, you really have to think about how you're restoring the body as well, because a lot of these treatments are pretty harsh to the body. So usually, by adding microbiome support, most of our patients do so much better than if they didn't have it. So now when I started doing this in my community, the oncologists around here, of course, are like, wait, what are you doing? But now I get referrals from oncologists to say, okay, we're starting chemo, go see Dr. Lily for some of the integrative therapies so that we can minimize side effects, because they also see the difference. And to me, that's a huge win, getting my conventional specialists to really see the results and really believe and understand that it is beneficial and start creating that partnership. It's been such a journey, because in the beginning it was very difficult. I'm glad we're at the place where there's mutual respect and we can work as a team. So I love working with cancer patients, because many times they're given really poor prognosis. And we have seen time again, the integrative approach beats the average survival time. pretty much every single time. And I've had pets with like metastatic diseases. Like just 2 weeks ago, we had a bulldog with metastatic oral melanoma. There were long nodules on their recheck x-ray. It's gone. Like it's just gone. Like I would never be able to see that practicing in just conventional space. Like I was taught that, oh, by the time it's metastatic, you don't have any other choice, right? Start thinking about euthanasia.
So what treatments were given there? How did that happen?
For that bulldog with the oral melanoma? So he rotates between high dose IV vitamin C and ozone UVBI. I don't know if we're familiar with that. It's an IV ozone therapy, blood ozone therapy. And he also started mistletoe injections.
Oh,
along.
Iscador. Yeah.
Yeah. Okay. Yeah. So, and microbiome therapy. And he also had a really severe microbiome imbalance. And I can't remember, a lot of my cancer patients have quite a bit of toxicity too. I've been finding a lot of glyphosate toxicity. We're starting to find some mycotoxins. So many of them also, I have to think that some of the trigger is the toxins in the body. So making sure that they are detoxed properly is a huge part of the healing journey. And many of them are actually, probably 90% of them are really deficient in vitamin D. And that link's been proven, right? Like a low level vitamin D can, I say that with quotation, can, not every single time, that can be a trigger for cancer. So, and I do find low vitamin D is very common in pets with cancer. So I wonder if we found those earlier, could we have prevented the progression of issues? Something really hard to prove, but I do strongly feel we have to do better.
Yes.
And it's so exciting when you see results that you know as a vet are not supposed to be possible, isn't it? I mean, it's hard to...
It's nice to take those x-rays, right? Where there's no doubt there were pulmonary nodule. Can I prove that they're metastatic? No, because nobody actually biopsied those long nodules, but we all know what metastases look like on chest x-rays. And then you get one 3 months later and it's not there.
Amazing.
It's working, whatever it is, whether it's metastases or it's pulmonary nodules or granulomas, I don't care. There was a pathology and now it's gone. So I'm happy. And the dog feels really good.
We actually
even the visible part, the oral melanoma that was irregular and you could see, that softened and got smaller. So there's that part too.
That's awesome. We actually do have a question from one of our listeners that I think you'll be very happy to answer. So it's a little bit of a longer one. It's from Annette. She has a 6-year-old German Shepherd, and she's already removed 10 cutaneous horns and cysts, and more are still popping up. They tested benign. So yeah, no more surgeries, but unfortunately he's have one now that he gets to, and he's licking a lot. He does have a lick protective sleeve, but he's itching underneath, and unfortunately he can get to it. She's using a hydrocortisone spray from the vets, and she's wondering if chamomile tea could help with the itching. She's also wondering if cryotherapy could be an answer for him. But yeah, the most important thing is that why is he prone to these? I've only known older dogs that get them, and it's only 6. And she wonders if it could be an immunity problem. He is entire raw fed and had a leaky gut a few years ago, but she's been working on that and back on raw and all good, but he's become a bit reactive due to pain. He's noticed his fur is a bit slow to come back on places where he's been shaved for surgery, and his skin is a little dry. He's a good varied raw diet and different proteins. He takes Pro Raw Dog Boost supplement, CBD oil, Reaflex for joints, and chamomile tea. Has a night supper for his occasional hunger pukes, and he had a leaky gut and got anxiety from losing their other German Shepherd and got a bit reactive since. And wonder if we had any thoughts on that.
I have a lot of thoughts. How much time do we have?
Go on.
All right. So of course, not knowing that was really good history. What I hear is that we're worried about these skin lesions that, many of them have been removed, but they keep coming up, right? And I'm also hearing that there's been some gut issues, there's anxiety issues. There's some really good nutrition supplements and all of that. So let's take a step back for a second, because I cannot tell you which part exactly is not working, but there's definitely the gut and immune system issues, right? Probably looking at the gut portion is still the most important thing because of this history of leaky gut and the ability for any animal to really process emotions. We know the gut is the second brain. Actually, a lot of the anxiety and stress can be originated from a gut that's imbalanced, right? So I would come back to the microbiome. If you have ability to test for the microbiome, that's where you start. So the food portion on raw food or all these wonderful supplements that you're giving, if the intestines and the gut's not healthy, it's actually not being absorbed. So I actually have had a lot of patients that has a wonderful diet and wonderful supplements. And when I go and test their vitamins and minerals, they are deficient. And I know it's present in the food. The body is not taking it. So for all of these things to work, the gut has to absorb really well. The skin, the reason why we could get repeated issues with cysts or masses that come up, even if they're just benign, skin is the biggest organ of the body, right? So it is actually a signal that something within the body is trying to either detox or make itself out, or the immune system is a little deficient, because these cysts are popping up are probably ways that the skin is taking on the load of what's going on within the body. So I hope that makes sense. I think there was a question originally, like, can we put chamomile tea on it? You can, it will soothe it, but we haven't fixed why, these cysts are popping up in the first place. We do have to do a deeper dive. Most of the time, I find that there's usually either a microbiome issue or that there's toxins within the body, and the skin is trying to do a little bit of detox, and that's why it's coming out. It depends on what stage of the condition we are in, because sometimes if the condition has progressed for some time, reversing it can also take really long. So sometimes you do have to balance out how quickly do we need to see some results. So there are some therapy that I reach for that we actually just talk about with the cancer patients, that I do start these patients sometimes on IV therapy. So there's some wonderful IV therapy that can help with increasing antioxidants and detox. So IV vitamin C is one. IV glutathione can be really, really helpful as well. Ozone therapy, I don't know if do you guys have access to ozone therapy much? Because that is such
I don't think we do.
Okay. Oh, okay. All right. Because that, aside from microbiome, these days, if I can't practice without ozone, I can't practice. I feel like I won't be able to practice. It's done wonders as far as being able to help even on the microbiome therapy, reducing inflammation, increasing oxygenation, and just on the preventive care side, it also is not, I feel like should not be as hard as it should be to have people get access. Sometimes people can buy their own machine and do it at home, like a rectal infusion of ozone gas. There are training courses you could take. But one easy way to detox is infusing ozone gas rectally. We call it rectal insufflation. And that can be really helpful over time. If I have to come up with one thing to help this dog right now, I would say, okay, check the microbiome, because that needs to be healthy for all these diet and supplements to work. and start some ozone therapy.
If I can,
yeah,
sorry.
it's worth looking into. No, I was just thinking it's worth looking into, isn't it, Lise?
Well, what I was going to say about this particular case is that I definitely don't think it's a case for home treatment. And it sounds, when we get lots of all the different symptoms, it sounds to me like it starts out as a question about what should we do about the itch, you know, would chamomile tea be helpful? And actually the itch is the least worrying of everything I heard. So I don't think it's the story of how to soothe the itch. I think there was a mention of him being reactive because of pain and him having had surgery, and we don't know exactly why is he in pain and what was the surgery for. But there's a lot of more serious issues, physical and emotional, other than the itch. So I think it's very much the case in my experience that when there is an itch, it's so in your face, you know, it's constant and it's annoying and it's visible and you can't ignore it. So it gets noticed a lot and talked about a lot. But actually on the problem list that this dog has, the itch would be the least of the problems, I would say. But I would certainly think it was a situation where you need to find a holistic practitioner and have very targeted, individually selected treatments to sort of strengthen him. And it's very much the case when you've got a patient who's out of balance, that they have a million different diagnoses and you can chase those forever, trying to find something for that and something for that and something for that and something for that. But if you can find the treatment that gets to the root of the imbalance and strengthens the whole individual, then everything kind of falls into place. And I think this is the sort of dog that needs that. I think it needs a deeper acting treatment to feel better, and for more than just the itch, for some of the more serious concerns here to get better.
That's why I'm like, how long do we have?
Because
this is not the itch. And that may be the reason why we got to where we are, because the industry is so focused on curing symptoms, like here's a drug to make the itch go away, but we never actually fixed what caused it in the first place.
I work in a conventional practice, and you know, when I get a patient early, you know, like, oh, it's a pretty young dog, he just started itching, I'm like, thank God you came to me. Like, I can help you and we can get rid of this, so you don't have to like go on medicine your whole life. But then when I get an older patient and they've been on like every medication for like 3 years, I get so overwhelmed. I'm like, where do we start? And it's but I did want to ask though, Lily, do you have any experience with cryotherapy, with like freezing lumps or bumps?
Yeah. I mean, that's like, don't have a
that's
whole
kind
lot
of
to say about that.
Isn't
it's
it?
like here's a small mass, you can do cryotherapy and it's gone. I still do some small surgeries and procedures just because sometimes it's really rewarding to be like, here's this, and now it's gone. There's not
too much thinking involved.
Yeah,
just a mechanical problem.
If you just want to remove this, that's probably the easier part of medicine.
I guess our recommendation would be, yes, you can do cryotherapy to remove this one lump, but you should see an integrative practitioner to get everything sorted so it won't happen again.
Because it will just, another one's going to pop up just based on what I hear. So
and they're not really the main problem. I mean, they're an irritating part of a much more serious problem, I would say.
Okay. We have some smaller question here as well. I think Christina really wondered about homeopathy, if it's better liquid or in pill forms.
That sounds
I
like
feel that's a question for someone else.
And I can do a rare short answer. I mean, homeopathy comes in all sorts of different forms. It can be small pills or large pills or tablets or powders or crystals or liquid. And the short answer is it doesn't matter at all. It's whatever the patient prefers. I normally use sugar pills when treating animals, because it's just generally much easier to get a horse or a cat or a dog to accept a bit of sugar than to be fiddling with syringes or teaspoons of sort of liquid that needs to have an alcohol flavor if you're preserving it as a liquid remedy. So I tend to use the sugar pills, but the short answer is it doesn't matter. The liquid remedies have the disadvantage that they will go off. I mean, it's a watery solution. So once you open them, they will always have some alcohol in them to preserve them. But once you've opened the bottle, I tend not to use it for more than a few, well, certainly a matter of weeks. And if you keep it out for longer, they'll start getting green things floating in them, and just not seem like a good idea to take it. Whereas tablets or pills, they have to have an expiry date on them by law, but they can be used forever. You know, people are still using remedies that are a couple of 100 years old, and you can certainly keep them for decades. Never throw homeopathic remedies away because it says on them they're expired. If they're a dry form, they will never expire. Store them properly, keep the lid on, then pills will last forever. Whereas liquids, if you've opened them, they will go off in a few weeks. So those are my reasons for preferring pills. But the very short answer is, doesn't matter at all. And the amount you give obviously doesn't matter either. So it's easy to give homeopathic medicine.
Do you know how much I love homeopathy? And I find the tablets easier because I like to sometimes squash it between two metal spoons so that you end up with like a powder you tip in the mouth instead of one tablet, which invariably gets spat out by some dogs or a cat.
But even if it does get spat out, it doesn't matter. It's fine.
Well, I've heard that before. I don't know. Well, that's part of what I was going to say.
Sorry.
But yeah, well, I mean, I was told by one homeopathic vet that as long as it's touched the gums in the mouth, it then doesn't matter if it's spat out, because they have taken in that like millisecond, they've taken in that force. So that's good to know. But I have found, just on a very practical level, that if I order the tiny little round pills and I try to squash them between the spoons, they ping off. Whereas if you get the flatter tablets, obviously you can crush them much easier. So that would be my save them pinging around your kitchen, you know.
I just take a very small pill and put it in, and it's not possible to spit it out without touching it. And the thing is, it doesn't matter whether it's a tablet or a pill. The medicine is not in the substance of the pill or the tablet. Yeah. Those are just sugar. It can be sucrose or lactose, but it's just sugar. The medicine is a surface coating. It's like a lining on the surface of the pill or tablet, which is why as soon as they touch the tongue or the inside of the cheek or the gums, as soon as they become wet, it's immediately absorbed, and the rest is just sugar. So, and the sugar doesn't matter. The sugar is just a carrier.
It's amazing, actually, isn't it, when you think of that?
Oh no, it's yeah.
I don't quite like it because I hate this. I don't really eat sugar anymore, so I get this like sugary layer on my teeth after. I just want to brush my teeth.
Don't so you can
that. You can take it in alcohol.
Oh, it's even worse. Yeah, and there was also a burning question on how to feed raw economically, because obviously for some it can be a bit expensive. And I think this is cool because now we have an aspect from every country, because I think it can vary a little bit as well. So Lily, what do you recommend your clients?
So here we have some food co-ops, right? And you kind of have to look for some of these resources. I don't know off one, like right off the top of my head, I can give you, we put it in actually Instagram posts, like how to do raw food or even fresh food economically, especially if you have a big dog, make it more affordable. But there are ways where sometimes you would have to have a good relationship with the local butcher, right? Because when they prepare their meat, there are always like some waste and leftover that sometimes honestly they just throw out. So many of my clients that do that will have a relationship with the butcher that they love, where they work out a deal and they can get the raw food a little bit more economically for themselves. So those are the ways that I know. And then there's some, when I say food co-ops, they're basically more like organizations that will organize these for you. So you become a member, and then you can get foods for a cheaper rate.
Sounds good. I don't know whether we do have that happening over here officially. Probably people get together and do decide.
In my personal experience, the key to feeding raw or fresh, well, raw, is to have a freezer. A big freezer seems to be the key in my experience, because you can it's just easier to buy bulk, and even if you buy, very often you can buy human grade supermarket meat reduced, and if you then really just buy it when it's reduced and freeze it, then you've got easy access. It quickly becomes expensive if you have to buy every week or buy smaller amounts and can't store it.
Yeah.
DIY is definitely cheaper. Go on, Tina, what were you going to say?
Yeah, that was almost exactly what I was gonna say.
Yeah,
Karen,
it's got to be. It's, yeah.
that is like, even do you have more time or do you have more money? Because if you have more money, you can buy a good commercial product, but if you have more time than money, then maybe in most countries it's cheaper to actually make it yourself. So you can go to, like they said, go to local places, buy things on sale, maybe, yeah, buy locally from like smaller farms, or even, you know, wild animals, like anything that is like cheaper and safe to feed. And then, yeah, I would go from those products. There are so many things you can get like cheap from the store that you can use for your dogs. So
absolutely, I'm always finding like kidneys or livers or something on the produce shelf,
And
because like,
actually,
you
those
know,
are the most nutritious. The
yeah,
organ
often
meat.
they are, and we don't want to eat these. Kids are
Yeah.
like, I don't think so. So they go in my dog's bowl. Yeah, I think this is the thing. It's got to be DIY. That's a big factor of it, really. But also, really, over here, the cheapest way to do it is to feed lots of raw meaty bones, and then to get these offals like we just mentioned, that you'll find cheap, and reduce your livers and your kidneys in the supermarkets. And also to feed tripe. Tripe isn't an expensive meat, and it is really nourishing for them. And what I tend to find as well is, if you want to be adding supplements and things, feeding only raw meaty bones, that becomes quite tough. So you've got to find a way to get those in. So if you did want to add in, say, some wheatgrass for some vitamin E or something like that, you need really a little bit of a mince meal to be able to do that. So tripe can be an economical way of doing that. So I think that, yeah, raw meaty, I mean, people have to really come to terms with feeding raw meaty bones, because they really are an economical way to provide everything the dog needs. And they're really good as well for periodontals side of things as well. So the more they can be stripping and pulling at a raw meaty bone, you know, and then you've got the enrichment. There's just so many great ways. But that really is the cheapest way that is still really good for the dog. If you're just looking at these ready-made foods, that's probably one of the most expensive ways, I'd say. But it's the way that we feel most comfortable with, usually. But once you get used to feeding DIY, it only really needs maybe one session with a consultant, either from the APNC or somebody like Tina, for instance. And they can point you in the right direction for your dog as an individual. And then you can learn from that and grow from that base that you've come up, that conclusion that you've come up with the consultant or the vet. And then you can move forward from that, you know, knowing that at least initially you're doing all the right things.
exactly. Should I go on to next questions? We have 7 minutes.
Yeah.
Well, these are kind of long ones, but I can do maybe this one. So Amy actually just asked in the chat, why would be the reason when the eyes are the most itchy part of the body?
The eyes?
Yeah, so
oh, sorry, you mean round the eyes? Maybe the skin around the eyes?
the eyes, when the eyes is the most itchy part of the body. So I'm assuming her dog probably has some environmental allergies or something, and it's itching from the eyes, and she's wondering why it would be only the eyes and not the rest of the body.
Might be meridian line related, that's the place that the energy is forming, but that's a question for somebody else.
I guess right. My question is like eyes as in like the eyeballs. Like do the eyeballs have pathology? I feel like this is a case we have to see like the conjunctiva red. It's like the conjunctiva is itchy, like it's more of like inflammation, allergy, like, or pathology within the eyeball themselves that you have to fix, right? Or is it like it's discharged, that it is more of an environmental secondary thing and we're itchy because, yeah, like what Caroline's saying, around the eyes and not actually the eyes. So maybe need some clarification.
Yeah, we need more information, and we can try again next time, because there's lots of reasons why eyes might be itchy. And particularly in very young dogs or cats, it's very common to get conjunctivitis or to have some, you know, lots of different possibilities actually, why the eyes may be inflamed if nowhere else is inflamed. So I think more information would be good.
I think the only thing I would add is very often, if it's like an allergy-related itch, very often environmental allergies. And in Chinese medicine, the eyes are connected to the liver, so maybe there is an energetic imbalance in the liver. So yeah, that's the only thing I would add. But yeah,
Till
hopefully
we
it
know
depends
more.
on the picture. Unless they have long questions.
Can you shorten them?
Was one person wondering if she could take her dog traveling with only rabies titer and not doing the actual vaccine.
Oh, we were
That's
talking
up
about
to
that just
the-
before we went live, weren't we? Do you live in a place, Lily, where your dogs have to be rabies vaccinated?
Mhm.
You do?
Yeah, it's a law here. You have to actually have the vaccine. It there's some nuance to that.
What are you trying not to
that
say?
I can't really say publicly.
I could see you're something you're trying not to
We're
say.
gonna be compliant with the law. That's what I'm going to say. Within that, I will say I run a lot of titer testing, and then we make some individual decisions based on that path. There are some exemption letters that we could write as a vet, and you have to work with where we are, that there's also like a separation between like state laws and city laws and like federal laws and all these different governing agencies that may have different sets of rules. You kind of have to know in what circumstances do you need this, right? Are you traveling to a place that absolutely needs to see a rabies certificate? Are you just trying to register with the city? Some cities do take actually titer results and attach with the veterinarian's letter explaining that this animal is considered protective. So it's not a one size fits all. I think it within boundaries of being compliant with local regulations, there are individual things we can do for that family and work out something just depending on where they live and what's going on with that animal to try to do the best thing for that animal. Yeah.
In Europe, if you travel, I think in everywhere, everywhere actually, if you travel across international borders, you need the rabies vaccine. And even though you can titer, certainly for rabies, by law, it's not recognized at the border instead of a vaccine. So you have to vaccinate every 3 years if you're going to travel, which can be very frustrating. And particularly this time of year, I have several daily conversations trying to persuade people to leave their pets at home so that they don't need to have the rabies vaccine. But it is a problematic vaccine to be giving. And sometimes there's no way around it if the animal needs to travel. But
there are ways if you do have to give it, just to make sure the quality of vaccine do matter, right? Like there are some that have less preservatives, and also you can, that's why I will let Dr. Hansen answer as well. There are a detox, right, from that's, there's things you can do, I think, before vaccines, after vaccines, to support on animals that you can minimize the side effects if you need.
Absolutely. And something as simple as not giving other vaccines at the same time is a simple thing to do. But if your dog travels across international borders, it needs to have a vaccine. And even though you can titer, it's not accepted in lieu of a vaccine. So it just makes it more frustrating, really, to do it for travel purposes. We are out of time.
Yeah, we're just at time, aren't we?
Yeah. Time flies in good company. Thank you so much for joining us. It's really interesting hearing about your experiences. Hopefully you'll come back again.
Yeah, this has been really fun. Thank you for inviting me. And it's actually really nice to just sit down and get to know you guys a little bit. Love to stay in touch and see what everyone is up to. I love the community you're building.
Yes, that's exactly what we're trying to do, and it's great fun. Thank you very much for joining us, and come back.
Of course. Yeah. Alrighty.
Okay, thank you for watching this week. We will definitely be back at 6 p.m. next Thursday, and we'll take some of these long questions, as Tina calls them.
Yes, we will get to them all.
Tina, do we have a guest next week?
Yes, we do. Who's
Rikke, we've got a Danish vet, Rikke, who is somewhat of an international expert, recognized expert in, well, we'll tell you next week. Lots of, very, very exciting guest. We'll tell you next week.
Okay.